and what can go wrong. We talked a little bit about stuff that can go wrong. Let's just take a closer look at some. Sometimes folks need to have a pacemaker. You're probably familiar with them. They are usually implanted just below the skin by the pectoralis muscle. And you'll see these electrodes are going into this vein, which then sends signals to the atria and then to the ventricles that helps establish the rhythm. This is a particularly interesting image. It looks more like it's zapping it, but basically it's just stimulating and setting now the pace that those heart muscles should be contracting in. Sometimes an individual needs an assist device. So unlike a pacemaker where it's just zapping the muscles, basically timing their contraction better, a ventricular assist device is going to actually help pump blood. It's an actual like little, I don't know, I wanted to say like a water pump kind of thing, but it's for your heart and it's for blood. So you can see the control unit battery pack are worn outside the body. Otherwise, the pump is inside, and it's basically taking blood from the left ventricle and taking it directly into the aorta. You may have this because for whatever reason there's been so much muscle damage, for example, that a pacemaker is just not going to do it, right? It's not about setting the right pace. The muscles themselves can no longer contract with enough force to move blood appropriately. And obviously the last major step then would be an actual heart transplant. And you can see how the heart is removed, the aorta and the vena cavas are reconnected, and the donor heart is put into place. Plaque buildup, it starts off small and then it grows. Sometimes bits can even rupture or cause damage to the endothelial wall, which then sometimes causes a blood clot to form. Obviously, this is bad for a number of reasons. Either blood cannot flow to the organ that it needs to flow to, or this blood clot, there's always the risk of it dislodging and then traveling and causing damage in a smaller capillary bed or in the lungs or even in the brain. You may have heard of a coronary bypass. So here's an example of a couple of different ones. So if there's a blockage here in the coronary artery, they simply will take another blood vessel, in this case the saphenous vein in the leg, and they will simply bypass it. So they'll take blood directly from the ascending aorta and put it into that right coronary artery. And then similarly here, they are now just taking it from, in this case, this left subclavian artery and bypassing this portion here of the left coronary artery into the anterior interventricular branch of the left coronary artery. So that's a bypass is exactly what it sounds like. Just go around where the blockage is. Now you may have heard of angioplasty and stents. So again, you can see the plaque buildup in A. They'll take a balloon. The balloon will basically mush. They'll inflate the balloon, which will basically kind of smush the plaque into the walls of the blood vessel, and then they'll put this mesh-like stent which keeps the blood vessel open. You may have heard of someone having an enlarged heart. You can see this is an enlarged heart. This was an individual who was morbidly obese. You can see how enlarged that heart became trying to pump blood to their body. Your heart should be about the size of a closed fist. That is impressively large, right? And this is just an example of some other things that can go wrong. You'll notice this pole, that is a gunshot through the heart. You'll notice some of this white area here that is actually cancer of the heart. I don't know how well you can see this, but this blue sort of darker color of the heart, that's due to a drug overdose. And then this proportionally, you don't really see this, but you can see how fatty this heart is. So again, this is a fatty, oversized heart of an individual who is morbidly obese. And then these are all just more FYIs for you. there are plenty of things that can go wrong. It's amazing that more things don't go wrong developmentally. So these are just some examples of heart problems that just when the heart doesn't develop correctly in utero. So for example, sometimes the aorta has this cinching part, so obviously that's going to restrict blood flow. Sometimes this ductus arteriosus will stay open. This normally closes shortly after birth, so you get this mixing of oxygenated and deoxygenated blood. Sometimes the hole in the heart, the foramen ovale, fails to close. So again, you get this mixing of oxygenated and deoxygenated blood. You may have heard of babies being born with a hole in their heart. That's what they're talking about. Sometimes that closes shortly after birth. Well, normally it closes right after birth. For some, it might take a few more days, and for some, you may actually need to have surgery. Another large defect is going to be this interventricular septum. Has a hole in it. So again, we have this mixing of oxygenated and deoxygenated blood that is bad. It basically minimizes the efficiency of the blood of the heart and being able to pump oxygenated blood where it needs to go and deoxygenated blood where it needs to go. And then this last one, there's just a whole series of problems. The aorta, the entrance of the aortas and both ventricles, there's a defect in the septum, there's this enlarged right ventricle, that pulmonary semilunar valve isn't properly formed. So again, there could be a lot of things that go wrong. Okay, well, hopefully you found this section to be informative and interesting. And if you have any questions, let me know.